Hi, everyone. Welcome to Learn English Through Podcast. I'm Emma.
And I'm Jack. Today, we're going to help you feel confident when you go to the doctor's office. Talking about your health in English can feel tricky, but we'll break it down into simple steps.
Exactly, Jack. Let's start with the basics. Imagine you're walking into a doctor's office. The first thing you usually say is,
Hi, I have an appointment with Dr. Smith.
right. And sometimes the receptionist might ask, can I have your name and date of birth?
So it's a good idea to be ready to say your full name and your birthday clearly. For example, my name is Sarah Johnson, and my date of birth is March 5th, 1990.
Perfect. After that, you might be asked to wait a few minutes. During this time, it's normal to feel nervous, especially if your English isn't perfect. But don't worry, everyone understands that.
Once the nurse calls you in, she might start with some basic questions like, what brings you in today?
This is important. This is your chance to explain your symptoms. You can start with, I've been feeling, and then describe your symptoms clearly.
For example, I've been feeling very tired for the last 2 weeks, or I have a sore throat and a cough.
And don't forget, you can always say, I'm not sure what's wrong, but I've been feeling unwell. That helps the doctor understand that you need guidance.
Also, it's helpful to mention when the symptoms started. For instance, the pain started 3 days ago, or I've had this headache since Monday.
Absolutely. Timing is key. Doctors ask these questions to understand how serious the problem might be.
Sometimes the doctor will ask about your medical history. Questions like, do you have any allergies, or are you taking any medication?
A good response would be, yes, I'm allergic to penicillin, or no, I'm not taking any medication.
And if you forget a word, it's okay to describe it. For example, if you forget the word allergy, you can say, I have a bad reaction to some medicines.
Exactly, Jack. Communication is more important than perfect vocabulary. The doctor will understand.
Next, let's talk about describing pain. This is very useful. Doctors ask, where does it hurt? And how bad is the pain?
You can say, it hurts here, pointing to the area, or use words like mild, moderate, or severe.
And don't forget to describe the type of pain: sharp, dull, throbbing, or burning. These words help the doctor diagnose you better.
For example, I have a sharp pain in my lower back, or I've had a dull headache since yesterday.
Also, mentioning what makes it better or worse is useful, like, it hurts more when I move, or resting helps the pain.
Yes, these small details make a big difference. Doctors rely on your description to decide on the next steps.
After you describe your symptoms, the doctor may perform an examination. Sometimes they'll ask you to sit, stand, or lie down.
Yes, and they might say, I'm going to check your blood pressure, or I'd like to listen to your chest.
It's common to feel nervous, but you can respond politely. Sure, or okay. Short answers are enough.
Also, don't hesitate to ask questions if you don't understand something. For example, you can say, could you please explain that? Or, I'm not sure I understand. Can you show me?
That's very important, Emma. Doctors are used to patients who aren't fluent in English. They want to help you.
After the examination, the doctor might discuss tests. They could say, we should do a blood test, or I recommend an X-ray.
You can respond by asking questions about the test. For instance, how do I prepare for the blood test? Or, is the X-ray painful?
It's also good to confirm the results timeline. You might ask, when will I get the results?
Sometimes doctors suggest treatment or medicine. They may say, I'm prescribing this medicine for you, or you should rest and drink plenty of fluids.
You can repeat it back to be sure you understood. So, I should take this medicine twice a day for a week?
Exactly. Repeating instructions helps avoid mistakes. You can also ask about side effects. Are there any side effects I should know about? And if the doctor gives lifestyle advice, you can respond, I'll try to follow that, or thank you, I'll do my best.
Sometimes, the doctor might ask you to schedule a follow-up appointment. They may say, please come back in 2 weeks, or we'll see how you feel next month.
You can respond by confirming the date and time. Does 10 a.m. next Monday work? Or, yes, I will come back on that day.
If you need clarification about insurance or payment, you can politely ask, is this covered by insurance, or how much will it cost?
Also, it's helpful to know basic phrases for emergencies. For instance, I feel dizzy, or I'm having trouble breathing.
Yes, these short phrases can be life-saving. Doctors will understand immediately.
Another useful tip is to bring a list of your current medications. You can say, here is a list of my medicines and doses.
It's also smart to mention past surgeries or chronic conditions. For example, I had surgery on my knee last year, or I have asthma since childhood.
This helps the doctor see the bigger picture of your health. If you're visiting a specialist, like a dermatologist or cardiologist, it's normal for them to ask more detailed questions about your symptoms.
You can answer clearly and briefly. For example, the rash started on my arm and has spread to my back. Or, I feel chest tightness when I exercise.
And if it's okay to admit if you don't know something, you can say, I'm not sure why it started, or I haven't noticed any triggers yet.
Doctors prefer honesty. It's better to admit uncertainty than to guess.
Finally, before leaving, always ask if there's anything else you should do. You might say, is there anything else I should be aware of?
Or, should I avoid any activities while I recover? These small questions show you're careful about your health.
Sometimes, after your appointment, the doctor may give you a prescription. They might say, take this medicine as directed, or you should take 1 pill in the morning and 1 at night.
It's important to repeat the instructions to make sure you understand. For example, so I should take 1 pill in the morning with food and 1 at night before bed?
Yes, and if you have questions about the medicine, you can ask, can I take this with other medicines, or are there foods I should avoid while taking this?
Pharmacies often ask similar questions. You can say, I have this prescription. Can you explain how to take it?
Also, don't hesitate to ask about the duration. For example, how many days should I take this?
And if the medicine causes side effects, it's important to inform the doctor. You can say, I'm feeling dizzy after taking the medicine, or I have a rash after using the cream.
Another important part of visiting the doctor is discussing your lifestyle. They may ask, do you smoke or drink alcohol?
A simple and honest response works best. For instance, I don't smoke and I drink occasionally, or I quit smoking last year.
Doctors may also ask about exercise or diet. You can respond, I exercise 3 times a week, or I try to eat healthy, but sometimes I eat fast food.
This helps the doctor understand factors that could affect your health.
Sometimes, doctors ask about mental health too. Questions like, do you feel stressed or anxious, or how is your sleep?
It's okay to answer openly. For example, I've been feeling stressed at work, or I often have trouble sleeping.
They might suggest strategies like relaxation exercises or therapy. You can respond, thank you, I will try that, or I'd like to learn more about that.
If the doctor recommends follow-up tests or appointments, it's useful to confirm everything clearly. You can say, so I should return next Thursday for blood tests?
Or, do I need to schedule another appointment after the results? This ensures there's no confusion.
Sometimes, patients worry about understanding medical terms. If you hear a word you don't know, you can ask, what does that mean? Or, can you explain that in simple words?
It's much better to ask than to guess. Doctors expect questions and will explain clearly.
After the consultation, doctors might give general advice. For instance, drink plenty of water, or get enough sleep and avoid heavy lifting.
You can respond with, I will follow your advice, or thank you, I'll make sure to do that.
Before leaving, it's good to summarize everything to the doctor. You could say, so, I should take the medicine twice a day, rest, and return in 2 weeks.
This helps make sure you haven't missed any instructions.
Finally, if you're unsure about any detail at home, you can always call the doctor. A simple phrase like, I have a question about my prescription works perfectly.
Or, can I speak with the nurse about my test results? Doctors' offices are used to patients asking questions after visits, and it's completely normal.
Being polite and clear is key. Phrases like, could you clarify that? Or, I'm not sure I understand, go a long way.
Sometimes, you might visit the doctor for sudden or urgent issues. They may ask, when did this start? Or, have you had this problem before?
You can answer with specifics. It started last night, or I had a similar issue 2 years ago.
For urgent symptoms, it's important to describe them clearly. For example, I have severe chest pain, or I feel short of breath.
You can also describe intensity using numbers. For instance, on a scale of 1 to 10, the pain is an 8. This helps the doctor understand the severity immediately.
If the doctor needs more information about your daily habits, they might ask, do you exercise regularly, or what kind of diet do you follow?
A clear answer could be, I walk 30 minutes daily and I try to eat vegetables with every meal.
Sometimes, doctors ask about family medical history. For example, does anyone in your family have diabetes or heart disease?
You can say, my father has diabetes, or no, there's no history of heart disease in my family.
If you're asked about previous treatments, it's good to give details. I had physiotherapy for my back last year, or I was on antibiotics for 2 weeks in March.
Doctors often give instructions for care at home. They might say, apply this cream twice a day, or take a warm bath to relieve muscle pain.
You can repeat these instructions to confirm. So I should apply the cream in the morning and at night?
Sometimes doctors advise lifestyle changes. For instance, reduce sugar intake or avoid heavy lifting for 2 weeks.
You can respond politely. I will follow that advice. Or, thank you, I'll make the changes.
If the doctor suggests seeing a specialist, you can ask, what kind of specialist should I see, or do I need a referral?
For children or elderly patients, the doctor may ask for additional details. You can respond, my child has had a fever for 3 days, or my mother has difficulty walking.
When doctors prescribe tests, you might need to clarify preparation. Questions like, do I need to fast before the test, or should I avoid exercise today are useful.
If you receive multiple instructions, it's okay to write them down or ask the nurse, can you repeat the instructions slowly, or could you write them for me?
Sometimes doctors give advice about monitoring symptoms at home. You can say, I will check my temperature twice a day, or I'll track my blood pressure.
If you need to explain allergies, you can say, I'm allergic to peanuts and shellfish, or I react to aspirin with hives.
Doctors might ask about sleep patterns or energy levels. You can respond, I sleep about 6 hours a night, or I feel tired most of the afternoon.
When leaving, always confirm the next step. For example, should I schedule a follow-up, or when will the lab results be ready?
And if you feel unsure, it's fine to ask, can I call if I have more questions? This ensures you're supported even after the visit.
Clear communication is key. Using short, simple sentences often works better than long, complex ones.
For instance, instead of saying, I've been experiencing a sort of mild discomfort in my stomach after I eat, you could say, I feel mild stomach pain after meals.
Doctors prefer clarity and brevity, especially when many patients are waiting.
And always be honest. If you missed the dose of medicine or didn't follow advice, tell the doctor. They can adjust your care plan safely.
Sometimes, after your consultation, you may need to visit the pharmacy. Pharmacists often ask, do you need instructions for taking this medicine?
A simple reply is, yes, please explain how to take it, or I understand, thank you.
Pharmacists may also ask, do you have any allergies? This is a good time to mention even minor reactions.
For example, I sometimes get rashes from penicillin, or I'm allergic to certain painkillers.
If you're unsure about timing, you can ask, should I take it with food or on an empty stomach?
And if you need clarification about side effects, what should I do if I feel dizzy or nauseous?
Sometimes you may need to explain symptoms that continue despite taking medicine. You could say, I've been taking this medicine for 3 days, but my headache hasn't improved.
It's also important to follow dosage instructions carefully. If you're unsure, ask, can I take 2 pills at once if I forget a dose?
For chronic conditions, pharmacists may ask, do you take this medicine regularly? Or have you noticed any changes since starting it?
You can respond clearly, I take it every morning, or I feel better since I started the medicine.
Sometimes insurance questions arise. You might hear, is this covered by your insurance plan?
A good response is, I'm not sure, can you check for me? Or, yes, it should be covered.
If costs are high, you can ask, are there generic versions available? Or is there a cheaper alternative?
Pharmacies often provide instructions in simple English, but if you're unsure, you can ask them to repeat slowly. Could you repeat that slowly, please?
Sometimes the doctor will recommend monitoring at home. For example, check your blood sugar twice a day, or measure your blood pressure daily.
You can repeat it to confirm. I will check my blood sugar in the morning and evening.
When symptoms change or worsen, it's important to inform the doctor quickly. You can say, my fever is higher than yesterday, or I feel more tired today.
Doctors appreciate details about patterns. For instance, the cough gets worse at night, or I feel dizzy only in the morning.
Sometimes patients need to bring medical records or lab results. You can say, I have my previous test results here, or I brought my x-rays from another clinic.
This helps doctors understand your condition better and prevents unnecessary repetition of tests.
In some cases, the doctor may suggest lifestyle changes. For example, reduce salt intake or avoid sugary drinks.
You can respond positively, I will try to reduce salt in my meals, or, thank you, I'll follow your advice.
For ongoing treatment, the doctor may say, we'll monitor your progress over the next month.
You can clarify, should I schedule another appointment in a month, or will I need more tests before then?
If you feel unsure about instructions at home, it's okay to ask, could you explain that one more time?
Even small questions help prevent mistakes. For instance, should I take this medicine before or after meals?
Finally, it's important to stay calm and patient. Clear communication, honesty, and asking questions when needed are the keys to a successful doctor visit.
Remember, no question is too small. Doctors and nurses are there to help you, and speaking clearly will make the process much easier.
Sometimes, after the visit, you might need to follow up on test results by phone or email. You can say, hello, I'm calling to check my test results. Or, could you tell me if my lab report is ready?
It's polite to confirm your identity. My name is Anna Brown and my date of birth is July 12, 1985. This ensures the staff can quickly find your records.
If the results show something unexpected, you may have questions. You can ask, what does this result mean? Or, is this normal?
Sometimes doctors recommend additional tests. You can respond, do I need to schedule the test soon? Or will it require fasting or special preparation?
For ongoing treatment, you may be advised to track symptoms or progress. A useful phrase is, should I keep a daily log of my symptoms?
If the doctor suggests lifestyle changes, you can ask for clarification. How much exercise is recommended? Or which foods should I avoid?
It's also important to discuss potential complications. You can ask, what signs should make me call immediately? Or, when should I seek emergency care?
For chronic conditions, you may need regular checkups. You can confirm, will I need to visit every month? Or can follow-ups be done via telemedicine?
When dealing with multiple medications, you can ask, can these medicines be taken together? Or, should I take them at the same time?
For vaccinations, the staff may ask your medical history. You can respond, I received this vaccine last year, or I have no history of allergic reactions to vaccines.
Sometimes you may need a referral to a specialist. You can ask, how soon can I see the specialist? Or, will my insurance cover this referral?
If you're traveling, doctors might give advice about travel health. You can ask, do I need any vaccines before my trip? Or should I take any precautions for the country I'm visiting?
For mental health concerns, you can express how you feel clearly. I've been feeling anxious for the past 2 weeks. Or, I have trouble sleeping and feel stressed.
Doctors may suggest therapy or counseling. You can ask, can you recommend a specialist? Or, are there resources I can use at home?
After any visit, it's always polite to thank the staff. You can say, thank you for your help today, or I appreciate your time and advice.
Before leaving, confirm everything once more. I will take the medicine twice daily, rest, and return in 2 weeks, correct?
Clear communication ensures there are no mistakes and helps you feel confident about your care.
Remember, being prepared, asking questions, and explaining symptoms clearly are all steps to making your doctor visit smooth and effective.
Even if your English isn't perfect, using simple sentences, pointing to the area that hurts, or showing written notes can make a big difference.
Keeping track of medications, symptoms, and questions ahead of your visit can also save time and reduce stress.
The key takeaway is honesty and clarity. Don't be afraid to ask questions, repeat instructions, or ask for explanations in simple terms.
With practice, visiting the doctor in English will feel natural. Confidence comes from knowing the right phrases and being prepared.
And that's everything for today's podcast on how to talk at the doctor's office. Use these tips, practice the phrases, and you'll communicate confidently with any doctor.
Thank you for listening to Learn English Through Podcast. Take care of your health, and remember, clear communication is the first step to feeling better.
See you next time, and keep practicing your English.